Oftentimes, if baby have zero bifidobacteria, they have colicky symptoms. They can't sleep very well. They cry all the time. They're really fussy. They have eczema or not, or some sort of rash, more yeast, diaper rash and things like that is connected.
Today's guest is Cheryl Sew Hoy, CEO and founder of Tiny Health, a pioneering microbiome health platform helping families take control of their gut and vaginal health from pregnancy and infancy to adulthood. A serial entrepreneur and mom of three, Cheryl's mission is deeply personal, empowering parents to understand the root of their family wellness, not just manage the symptoms. From baby eczema and food sensitivities to optimizing long-term health, Cheryl and the Tiny Health team are changing how we think about prevention one microbiome at a time. Cheryl, thank you so much for being here. Welcome to the show.
Thank you, Laura. I'm really excited to be here.
Yeah. So, would you just take us back to the very beginning? Was there like a personal or professional moment that sparked your fascination for the gut health and that led you to start Tiny Health?
Yeah, I've always been what you call a health nut, always since I was in my 20s, 30s, like biohacking or tracking my own metrics. I had a lot of the early watch trackers and all that. So naturally, when I got married and I got pregnant, I was, sort of very obsessed about prenatal health, preconception health, and things like that, and trying to optimize to, for my baby's lifelong health. So my first child was breached, so upside down
Mhm.
during pregnancy. And obviously, I tried all the things to turn her around, spinning babies and all that, and she didn't turn. So I knew that there was a big chance that I would end up in a C-section. So I started researching what it would mean for her lifelong health if the operation would be, obviously it's a big operation for mom. So I was looking at how I would recover from it. But, is there any consequences to my baby? And then
Uh,
I came across all this literature that C-section born babies' guts look very different from vaginally born babies. And I was like, okay, what does this mean? Oh, they have more unfriendly bacteria that are antibiotic resistant from probably the hospital environment because there's a lot of antibiotics being used. Mom also gets antibiotics before the surgery. So it kind of gets passed on to baby during the surgery. And then whatever baby gets from mom is wiped out, basically. And
mm,
basically, I was like looking at, okay, what does this mean? So baby is sterile in a womb. They don't have a gut microbiome in your belly. They first acquire mom's vaginal microbes on the way out through the vaginal canal. So
wow.
we swallow the vaginal fluid. And then because the mom is pushing and laboring, some fecal fluid comes out and
Mhm.
baby swallows it on the way out too. Sounds gross, but that is literally how baby acquires mom's vaginal microbes and then gut microbes from the stool, from the fecal fluid. So that's why sometimes actually we ask in our survey at Tiny Health, did you have a bowel movement during labor? Because then we
Mm.
kind of know that there's correlation between that and more microbial seeding from mom's gut to baby's gut. Now, why this is important is because mom is supposed to be transferring a really important bacteria in her vaginal microbiome, which is lactobacillus, and then a really important bacteria from her gut, bifidobacteria, to baby's gut. And that's what's supposed to be dominating baby's gut in the first year of life. So bifidobacteria should be 50 to 90% of baby's gut in the first year to train your immune system. And this is where it's really important. There's this critical window to train your immune system. And I would say the first 6 months is the most critical. And then it gets less relevant post solids or between 6 months to 12 months. Still important, but that first 6 months is the immune training window for lifelong health. And so this is what I learned that babies who don't get the right balance of microbes at birth or in the first 6 months then get like eczema between 3 to 6
Mhm.
months. And then eczema becomes a higher risk for food allergies, usually between 6 months to 2 years old. And then that cascades into food allergies, to asthma
Oh,
between
wow.
3 to 6 years old, and then hay fever. Uh, because sometimes it starts at two into adulthood, right? So
Yeah.
it's a progression of allergic diseases called atopic March. So I was sitting there, I'm like, oh, I don't want to, I can't control the C-section. What do I do? And then I found all this literature that I can course correct my infant's gut post C-section and what I can do to make sure I'm optimizing her gut to prevent these chronic conditions, right? sure enough, she was born C-section, and then she got eczema, and then food sensitivities, gluten, dairy intolerance, sesame allergy, all kinds of stuff. And I was like determined to really heal her gut. And then, I didn't start Tiny Health until I was pregnant with my second child. And then literally incorporated a company a week after he was born because I had a magical VBAC with him, a vaginal birth after
Wow.
C-section at home. And so it was the most wonderful birth. And of course, he didn't have any symptoms. His sister did. And then we did two years of R&D. And then we launched a product in April of 2022. The first baby gut test and the mom's gut and vaginal test during pregnancy and preconception as well. Because if mom's gut, what I learned from my second pregnancy is if mom's gut and vaginal microbiome is not in the right balance, then, she's passing that on to baby too, right? It's
Mhm.
preconception. It is important for moms and dads, frankly, to also check in, course correct, see if there's anything to do to improve it, to make sure your baby has the best start in life for chronic disease prevention. Because today, 1 in 2 kids per the CDC have at least one chronic condition, which is really high and should not be the new norm. It's insane that 1 in 2 kids are sick. So Tiny House mission is really to help prevent these chronic conditions for little ones, but also for adults. We're now also helping healthy aging in the longevity space. So adults can also do our test. But yeah, it's basically everyone asks me, what is it? Is it blood? Is it urine? No, it's a stool. It's poop. It's a poop
Okay.
test. You sample directly from the toilet paper or diaper, and this is how much you need. This is peanut butter. Don't worry. It's
Wow.
not,
That's a tiny amount.
that's a tiny amount. It's a lot of genetic bacterial genetic material in this tiny little swab.
Wow. Okay. I would love to unwrap what you were just talking about in terms of the whole journey, because thinking of tiny health, you think it starts with the babies, but it sounds like you should actually start your journey pre-conception. Would you be able to kind of dive deeper on that, what that actually means, as well as you mentioned dads on the side? I thought that that's very interesting. And in terms of, okay, how does it like, how do you give it to your baby? Is it just from birth or also through other things? Which is why it's important to do a preconception.
Yes, that's a great question. Have you heard of the first 1,000 days?
No.
The first 1,000 days, and some even baby food companies promote that. Like Yumi, I believe, speaks a lot about the first 1,000 days for the baby's brain health and like socialization and things like that. There's a concept that, it's this critical first 1,000 days is important for baby's lifelong development for any dimension, right? So we say that a lot in our website. You'll see tinyhealth.com that the first 1,000 days starts in conception. So the moment the baby's conceived in the womb is when it starts from a microbial sort of like impact, like the mom's gut and vaginal microbes is starting to train a baby's immune system in the womb. And then, of course, during birth is critical as well. So moms, for example, there's a short chain fatty acid in mom called butyrate function that should be high. And if the mom has low amounts of butyrate function, then the baby could influence baby's behavior at 2 years old. There's a paper showing behavioral differences in kids 1 year old and 2 year old, how external they are, how internal they are, how likely they are to be a little bit more inward, like a bit more, I wouldn't say depressed, but like the shy or things like that. So it's very interesting. And butyrate is one of these short chain fatty acid that protects the gut lining in the mom and the large intestine to not allow unfriendly bacteria to get out to the bloodstream and create inflammation, gut
Hmm.
inflammation. And it's basically, you get it from eating specific fiber, foods that are high in fiber. And so in our test, we don't just say, oh, eat more fiber. You don't need a $200 test to tell you that. We tell you specific fiber that your gut may not have the bacteria to help digest and how you should really add more of those foods specifically to help with fiber fermentation. It turns in energy into butyrate function. So anyway, this is pretty technical, but this is an example of how mom can optimize. But I mentioned earlier, bifidobacteria, a lot of moms and dads don't have it. I think I read a study up to maybe 90% of adults may not have it because it's very sensitive to antibiotics. So if you've had antibiotics anytime in your life and you don't take care of restoring it, it might be wiped out from your gut forever. And so it's something that I was obsessed about finding when I started Tiny Health. I wanted to know if I have Bifidobacteria infantis, specifically the specific strain that is the best strain to train a baby's immune system. And I realized I didn't have it. And then I was like going through this journey, asking my mom, how was I born? And I was like vaginally born, but I was formula fed. And so then I learned that formula feeding can impact bifidobacteria status too, because formula doesn't have HMOs, which are the prebiotic fibers that are food for the bifidobacteria to stick in the baby's gut. So if your vaginally born baby is not breastfed, then they may have low bifidobacteria too. So I would say, we educate parents to, if you're formula feeding, it's your choice. Sometimes it's necessary. Find a formula that has HMOs in it, or you can buy an HMO supplementation to add to your formula. So we give very specific advice like that. If your baby's lacking certain bacteria, how do you supplement with the right probiotic, but also prebiotic, so it
Hmm.
actually colonizes and not just goes through the baby's gut. And then the mom's vaginal microbiome is also important because some moms, if they have an imbalance there, no lactobacillus, for example, which lactobacillus makes the mom's vaginal canal acidic in environment, and acidity prevents disruptive microbes from colonizing in the vaginal canal, like streptococcus, like GBS, group strep we
Hmm.
did the tests during pregnancy that helps prevent that and other vaginal conditions. So it's good to check in, frankly, because having no or low lactobacillus can impact preterm labor risk, and also maybe other recurring UTI conditions and things like that. So it is really important to check in. When I had my C-section, I also did a vaginal seeding procedure.
Hmm.
And some of you may have heard vaginal seeding. And this was a study I read during pregnancy as well, when I was like looking at, oh, how can I, course correct the C-section? So you put a gauze in the vagina for the hour during the operation prep for the C-section. And then within 2 minutes of when the baby comes out from the C-section, my midwife was swabbing the baby with the gauze with my
Hmm.
vaginal fluids to mimic the birth canal route that the baby was
Amazing.
supposed to come
Yeah.
out. And so there's a couple of studies showing that babies swap with the gauze look more like vaginally born babies than C-section born babies. So that's what I did. And I think that contributed to my infant's. I mean, she had a mild eczema, we've
Hmm.
seen babies with really severe eczema. So I think what I did probably helped made it less severe.
Yeah. It's kind of funny because I was born as a C-section baby, and I
Ah,
have everything you just mentioned. Had
oh,
really severe eczema as a child, always had so many, like, just gut issues from really middle school all the way to college, where I would miss so much school because I just couldn't figure out what's wrong with me, and finally figured out that I had a dairy allergy, gluten allergy, all these things, right? And so, yeah, I'm definitely personally very passionate about it, but I haven't heard of it before that it matters. Like, obviously, I knew, in terms of the birth canal, but now going back, I really wish I would have taken a test during pregnancy or even preconception to learn more about my vaginal, like, bacteria, to know what I can optimize to make sure that that process is as well as possible for my baby, because I've already kind of seen, and I don't know, you can maybe get into that too. Whenever I feel like you can maybe get into, like, how does your vaginal microbiome actually look like after birth? Because what I've realized is that I had a few, like, yeast infections, and I think it sounded like when I did research that it was very common. And
yes.
whenever I felt yeast, she was yeasty, and I was like, "Wow, this is crazy." It's just, and I was breastfeeding, so is there, like, how does it all work together? It's just so fascinating.
Yeah. So maybe before I jump to this,
Yeah.
or maybe I can come back to that question, because I do want to address, because there's a lot of weight put on mom. Obviously, it's all feels like all mom, but there is a dad component. So maybe
Yeah.
I'll come back to that. Remind me to talk
Of
about that.
course. Yeah.
Yeah. So, but yeah, the whole vaginal connection is really interesting too. So, I've been testing, right? Because I just had my third child around the same time you did, actually. So
Congratulations.
he's almost 9 months, and yours is
Oh,
11. Is
goodness.
that right?
Yeah. Yeah.
Okay, great. Yeah. So
Yeah.
around the same time. And so was testing my vaginal microbiome preconception during pregnancy because, I owned a company. Why not, do the test? I want to make sure my vaginal microbiome is in good shape. And I've always had really high lactobacillus crispatus, which is the best lactobacillus, most stable and most low risk for any STIs, yeast, or GBS, or any sort of infection or issues. It was 100%. We score kind of your microbiome in our test. Partum, I went down to 23%. 2 months postpartum, right? And I just did a test like yesterday because I want to check in at like around 8.5 months. Um, and so I had zero. I went from like
Wow.
98% Lactobacillus crispatus to zero Lactobacillus. And I don't have any symptoms. And you don't always have symptoms. Sometimes you do, sometimes you don't. Obviously, postpartum, you're a bit dry and you're healing and all that. I had a vaginal birth for my third. But so, like, early on when we found this out, because it happened with my second child too, I had perfect vaginal microbiome and then terrible. So the scientists at Tiny Health were like, why is God punishing us postpartum? What is this, right? Why are we getting terrible vaginal microbiomes after? And then we realized, oh my gosh, it's a natural child spacing mechanism because if you have no lactobacillus, there's actually studies showing a lower chance of IVF success. And we've only done studies with IVF candidates, but we think that's a proxy for fertility and conception
Interesting.
abilities. And so it makes sense, right? Like, maybe your body is still healing, your hormones are depleted postpartum. So you're not really supposed to have a good vaginal microbiome because then it may make conceiving again quickly too fast, right? And so there's also studies showing that you shouldn't actually get pregnant. Ideally, the space between the first and the second kid or subsequent kids is at least 12 to 18 months.
Mhm.
Again, I think your body has to take that full time to heal. You're also ideally breastfeeding for the first year. WHO recommends 2 years. So your menstruation may not even be returning. And until you wean or menstruation returns your body's hormonal system is back in like 100%, right? And that does affect your vaginal microbiome. So it all maps out. It all makes sense. If you do get pregnant, when your vaginal microbiome is disrupted, low or no lactobacillus, studies have shown that it is a higher risk for preterm labor for your next child. So you don't want to get pregnant before your vaginal microbiome is adjusted back to normal. So now I know what I know. I would test my vaginal microbiome. If,
Yeah.
a lot of us moms are having babies later in life,
Mhm.
prioritize our careers and all that in our 30s. And I had my first child when I was 35, and now I'm 42. I'm pretty old with my with my third. And I do see some of my friends like, oh my gosh, they're trying to hurry, right? Like, I want to have more babies, bam, 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 and have
Mhm.
babies back to back 1 year apart and things like that. And then I hear a lot anecdotally, of course, my circle of friends then having the preterm labor, not
Mhm.
all, but a lot of them, if you do have back-to-back babies, knowing what I know now, like you should check in to see if your vaginal microbiome is in good shape before you have one.
So would you be able to optimize it? So let's say I am pregnant, I got pregnant again, and I'm concerned about that. Would it be like, would you suggest taking a test and then basically you get instructions exactly how to optimize it and then you test again? Would you be able to kind of walk us through that process?
Exactly. The vaginal microbiome is harder to adjust than the gut, I would say. Gut, it takes also sometimes, depending on how imbalanced your gut is, it may take somewhere between 2 months of really disciplined dietary supplement lifestyle changes. It could take 6 to 9 months, as it took me 6 to 9 months. So I would say even do it like in advance. If you know you want to have a
Mhm.
kid someday and you're not even quite there yet, I would say do it now. It's never too late, right? The vaginal microbiome takes I think also we've seen 2 months of the vaginal microbiome really shifting, but more often than not, 4 to 6 months. So that's why it's important to really prepare a preconception. But, again, we just don't know. Everyone is unique and different, right? So it's like we always get asked, "Is it too late? Is it too late?" I'm like, "I don't know. It's never too late." I mean, I rather know, right? So that even if you can't do anything like now for this pregnancy, when the baby comes out, like maybe what are potential microbiome risks to the infant and how you can course correct. And we give you all the tools to do it. And the recommendations that we make are very evidence-based. So you can click in, it's a web portal with all your results and what is in your vaginal microbiome or your gut microbiome. And we tell you what you can do if you're very diet, nutrition oriented, or
Hmm.
if you're a supplement, like give me the supplements. For vaginal microbiome, there are vaginal suppositories that you can do that we would recommend. And again, there's a lot of caveat during pregnancy. So again, ideally you're doing it preconception. It's just that a lot of studies and research are not done on pregnant moms as
Hmm.
you would
Right.
expect,
Yeah.
right? So a lot of them are required because of that to say, check in with your doctor, not recommended during pregnancy, postpartum, breastfeeding, because they just don't know, right? But frankly, you make your own judgment, you do your own research. If you're comfortable with it, um, you know, then go ahead with the advice of your a practitioner or your I see a functional integrative medicine practitioner. So I lean more towards food as medicine, supplements, lifestyle changes than medication, for example. So that's
Hmm.
just my choice. So it's up to you how you want to approach it, right? But I think getting the data and knowing what's in your body is so important. It gives you the control and the power to make the choices, right? So I would say if you're pregnant, do it, because if
Hmm.
you have a really good vaginal microbiome, then, and if you plan B ended up with a C-section, you can do the vaginal seeding procedure and be confident that that would help your baby, for example, may
Yeah.
help your baby. And if you don't have a healthy vaginal microbiome, then and you can do the vaginal suppository. And there's also vaginal oral probiotics that you can take. And as you can imagine, because you're taking it orally, it gets to your gut first. It has to get through
Hmm.
your stomach acid and then get through from your gut to the vaginal microbiome. Is a longer route. So you may have to take that for 2, 3, 4 months. But that plus the suppository and vitamin C and just things like that, omega-3 and all that can help adjust the vaginal microbiome between 2 months at the earliest, but sometimes 4 to 6 months.
Wow. So start early so you can adjust it. And maybe should we go back to dad now, how that plays in since we're like in the early conception, preconception days?
Yes. So, early on when we launched, it's all like maternal infant health, focus on the first 1,000 days. And then we realized, because I was very curious, what about dad's contribution, right? Because mom, through a vaginal birth, she usually contributes about 75% of her gut microbes to baby. You don't see a lot of vaginal microbes because it's there to colonize, to seed baby's gut initially in the first week. The lactobacillus seeds baby's gut in the first week, we think, and then it's gone. You don't really see it anymore. And then the bifidobacteria comes in and sticks around. So we think lactobacillus from vaginal microbiome and bifidobacteria from gut are BFFs. They're best friends. They need each other to like help colonize. It's all a magical plan. Nature has it the best way, right? So then it's kind of like, well, if mom doesn't have bifidobacteria again in her gut, then she's even through a vaginal birth, and then you're continuing to transfer bifidobacteria through breast milk because you asked, is it just birth? No, it's also postpartum breast milk. Breastfeeding is actually even more impactful to baby's immune system training and gut health than the birth mode. So someone who had a C-section and breastfed their infant for a whole year may have a healthier gut than a vaginally born baby who's formula fed from day one and
Mm.
breastfed, right? We've seen a lot of studies, and in our own data, we've done over 100,000 samples now. So we have a lot of baby data, mom baby data. And then, so 75% usually comes from mom through vaginal birth. And then if the mom had, and then 25% usually on average from dad throughout the
Okay.
first year of life. And in that first year of life, 75% from mom at the beginning in the first few months of life, and then it goes down to 75%. So by 1 year, dad and mom are contributing around the same 20, 25% of their gut microbiome. They're sharing with their baby because they're kissing, they're sharing food in the same environment, they're breathing the same air, using like, same floor. If you had a C-section, the dad is contributing just as much. So mom is contributing around 25%, dad is contributing 25% too. So
Wow.
they're contributing just as much as mom. Isn't that crazy?
Yeah, that is so crazy.
Yeah. So, fun fact, for example, there's I mentioned bifidobacteria and lactobacillus, two microbes you should absolutely remember. That's the third one that's really important for baby's health and also mom, adult health, metabolic health. Archimenzia, really hard to pronounce. AKK, archimenzia. It's a long word, which is important for also eczema and asthma prevention. Actually, so comes from mom or environment or pets. If you have pets, your baby's more likely to have archimenzia, actually. And babies, we don't typically see archimenzia until the first year of life, but we know it's transmitted from like mom usually or dad. So I didn't have any. I still don't. This is one thing that I can adjust. I didn't have any bifidobacteria, but I managed to get it up after 6 to 9 months. It took me a long time to get that back into my gut. And but archimenzia, I just could not. My husband thankfully has archimenzia. So I'm like, when we started solids with our infants, I'm like, can you like feed, the baby more and pre-chew the meat that pre-digest, in the old days, that's what they did. The dads and the moms pre-chewed meat to tenderize it with the enzymes in the saliva before giving it to their infant. This is traditionally practiced. Sounds gross, but it just how
Yeah,
babies were fed.
it makes sense.
So I like passed me to my husband, "Can you pre-treat a meat?" So both my kids have archimenzia now. I'm like, "Yes." And the third is
Wow.
too young to test, but at 1 year old, I wanna see if he has it too.
Wow. That's incredible. I had no idea. That's just wild, right? Nature
It's
is
okay.
so wild. It's so fascinating. Okay, so it's interesting because I almost feel like sometimes you hear don't put your baby's spoon in your mouth because of like bacteria or whatever. And so it actually makes sense. We'll take care of your own gut health and your microbiome. And if it's balanced and healthy, it can benefit your baby. Can it harm if it's not balanced?
Yeah, there's something called so what is the microbiome? Maybe going back to 101, right?
Yeah, let's do that. Yeah,
You don't
absolutely.
even know, what do you mean by microbiome? And
Yeah,
sometimes
let's go back to that.
microbiome.
Yeah.
You know, it's basically you think about us having human cells in our body, right? But we actually have more bacteria cells in our body. So the microbiome means like we have like basically 39 trillion microbes living in and on us. And they're different microbiome sites. So there's the oral microbiome in your mouth, which is very different from skin microbiome and different from the gut microbiome and vaginal microbiome. There's the breast milk microbiome. There's all kinds of microbiome, right? Um, and out of the 39 trillion all in our body, 38 trillion are in our gut, which is the large intestine. What is our gut, right?
Mhm,
So there's the small intestines where you digest and absorb nutrients. There's the large intestines where water is being absorbed, and that's where your stool is, your poop, right? So the poop, this is why it's a poop sample, represents the large intestines, where you think that's for digestion function and where the poop factory basically, but it also is where your immune system lives. So 70 to 80% of your immune system is behind the large intestine cell walls, or the small intestines too.
mhm,
And so if you have a leaky gut, like if you have basically your gut lining isn't like, their gut lining has these walls basically in your gut lining. If there's not like holes, but kind of, if you want to picture that,
mhm,
the gut lining is weak, the tight junctions, then food particle can go through and basically, what do you call, trigger your immune system. Or if you have a lot of E. coli or salmonella, or we encounter E. coli every day, every time, even now in the air, probably there's some E. coli, right? It's not all clean. And your immune system is supposed to just flush it out, right? And go through your gut and all that. But if you have a leaky gut and a weak barrier, it may leak into your bloodstream and cause inflammation because then your immune system is reacting to these food particles and this unfriendly bacteria. So that's like kind of the explanation of what gut inflammation is, internal inflammation. Your body's kind of inflamed and fighting something internally, right? And so babies, it happens to babies too. And that's what haphazardly trains their immune system. And that's how you get eczema and allergies and asthma and all kinds of things, right? So those diseases are a sign of immune imbalance actually in at birth. But that's kind of why it's so important to figure out your gut health. Even if you're not planning for a child or baby, even you're just like, trying to optimize your wellness and health, you should like check in your gut because we can show you all these insights if you have high unfriendly bacteria or a strong gut lining, a barrier integrity, a butyrate function. Are you eating enough specific fibers and fermenting them and things like that? We can show you what to do.
That's amazing. And maybe you could get into why microbiome health is so important in these first 2 years of life, and maybe how it's connected to, you've seen so much data from thousands of families by now. So, like, what are you learning between the link between gut health and food sensitivities, allergies, and immune system?
Yeah. So I mentioned earlier the baby's gut, there's no gut microbiome in the womb, right? So that's how they first acquire mom's, and then also the environment, right? Whether or not it's hospital birth or home birth, whether or not dad or mom does skin to skin right away matters and what seats the baby's gut initially, right? So if you think of the baby's gut as like an island at birth, like it's pretty barren, like a new island, so to speak, right? And there's a few maybe like plantation, like vegetation there. You want to make sure there's the right coconut trees that's healthy, not weeds, right? So sometimes if mom doesn't have, like, if you imagine bifidobacteria as the coconut tree, like that's nice. And like if mom doesn't have it, then baby's not going to have it. The barren island will then be seeded with what weeds, all kinds of different weeds, right? And we think that, we don't know, like, why some babies have colicky symptoms, sleep issues. Some of them have very severe, like, eczema or cow's milk protein allergy, all kinds of allergic reaction to different proteins and things, right? And we suspect, and we're still doing research and studies on this, that depending on what kind of weeds, like, or unfriendly bacteria colonize the infant's gut in that first 6 months, first year of life, it may manifest in different kind of allergic diseases, right? Whether it's streptococcus, staphylococcus, Klebsiella, which is connected to eczema, is it E. coli. So basically, if you have the coconut trees, it doesn't leave room for the weeds to come and colonize, right? So you want majority of that island to be seeded with just coconut trees, the healthy kind of coconut trees, like 50 to 90%. So in an infant gut, then, but you don't want to completely get rid of the weeds. You kind of want 5%, 10% of them being weeds to train a baby's immune system to recognize that, oh, these are the healthy coconut trees. Great. And then occasionally you're going to have wheat coming in, right? So the baby's immune system has to recognize that and kick it out, right? So you want to have some. We see some baby's gut having too much of a good thing is a problem. No weeds is not good either, which means the
Interesting.
baby is maybe over sanitized, like the home environment, you're using maybe too harsh of a chemical and you have zero unfriendly bacteria. So you're not taking baby out to nature. You don't have pets. You're not exposing baby to like a variety of microbes. That could be an issue too. It's not training the baby's immune system. So in early life, there is a very precise balance of good and bad bacteria in a simple fashion. Um, and then the common question we get asked in this time period is, well, is there a universal healthy baby gut? How do you know, right?
Yeah.
Like Western culture, like industrialized culture, and like, rural culture, is it like the same? Well, you know what? The baby's only food in the first 6 months of life should be breast milk, right? Or formula. So if the baby's only eating milk, then the baby's gut is very simple and it's very universal for what a good baby's gut looks like in the first 6 months of life. When the baby starts solids at 6 months, they're starting very slowly. I'm sure your baby didn't really quite take solids. So maybe some babies like really eat a lot at 6 months. Some babies take a while, maybe 9 months, to fully really eat proper solids. Then that's where the ethnicity, the cultural influences come in, the weather and things like that. So that's kind of why, in a way, it's the first 6 months is the biggest opportunity to course correct an imbalanced gut. And babies may have symptoms, may not have symptoms. You just don't know. Oftentimes, if baby have zero coconut trees of bifidobacteria, they have colicky symptoms. They can't sleep very well. They cry all the time. They're really fussy. They have eczema or not, or some sort of rash, more yeast, diaper rash and things like that is connected. Not always, it really depends on hygiene as well. Or like, sometimes you don't know, right? But more often than not, if the baby always has yeast infection, I would say check in. There's no harm. It's always good to proactively check in. Um, and so this island is, if you imagine the bacteria, and when you start solids, you're introducing like little bit of a rainforest. Like, oh, this new vegetation is like, I don't know, papaya tree, or I'm thinking tropical, right? An island. maybe this pineapple, like good stuff, right? Diversity from food. And so when a baby is 3 years old, by then it's a rainforest. If you can imagine like a Amazon rainforest, and the roots are deeper, right? So if there's a lot of weeds instead of the healthy like vegetation diversity, you want lots of diversity. You want like hundreds of different species by then for resilience in the baby's gut. But if like it's weeds, it's much harder to unroot the weeds and then plant it with the right vegetation, right? So the earlier the baby is to plant the right vegetation, the right balance of it, the easier it is to modify the infant gut in the first year of life. Doesn't mean at 3 years old, you can't change it. You can, like at 3 plus 3. 5 year old, we have 11-year-old with severe acne issues and all kinds of digestive issues. Just that mom and dad and the child has to be willing to change the diet. And it's harder, like it's easier to change a baby's diet, right? Their infant than an 11-year-old, but it's possible, right? It's just very deeply rooted. You have to unweed and then plant new seeds and all that. And it takes a while the older you get. Does that make sense?
Yeah, absolutely. No, definitely. So to speak, it's never too late, but the earlier the better. And to really, yeah. And there's a lot of things that you were saying. One thing that I would love to get into is, first of all, kind of introducing solids. And like a lot of moms are nervous, right? About like, how do I do it? There's so many different techniques, as well as like introducing allergies and being really afraid of like doing it wrong. So, is there something that kind of like you wish they would know about the process that you would just recommend moms?
Yes, we have a really good blog post on this. If you go to tinyhealth.com/blog and
Okay.
the search bar, search for solids, we have a couple of really good guide on there. So I would say recommend that. And then resources too, like Solid Starts is a good one for baby led weaning and things like that. We do a mix of smashed foods, and we don't do as much processed like packs, we just serenity kids if we have access to them, but and some baby led weaning as well. I would say the biggest misconception around solids that's really confusing is that the guidelines from AAP keep changing over the years. And the latest one actually, because, kept changing from, do you introduce it at 4 months or do you introduce it at 6 months?
Hmm.
So timing changes. And then some say, oh, you have to do only one new food every 3 days. That is outdated advice. So we have all this in a blog content for what the most updated and scientifically backed research says around baby's
Amazing.
health. So 4 months is too early for
Hmm.
solids, like spoonful of food. But you can start introducing allergens around 4 months. And I'm not saying feeding them spoonfuls of peanut butter or meat. Like, sometimes if mom eats peanut butter, and then kisses the baby, that is also exposure that studies
Mm.
have shown to reduce peanut allergy in the infant. So some exposure like that through mom's diet and kissing and all that can help baby too. And then, we're talking about maybe a dab of like, you know, um, egg yolk or peanut if you want
Mhm.
as early as 4 months. But I wouldn't say for all my three babies, I really didn't start till 6 months because I know their gut was immature and can't really handle too much solids. So I was more kissing them with all these. But 6 months is when you really should start. And also delaying the start of solids could be impacting allergies. So if you introduce too late, it's not good because again, babies on a clockwork, their immune system is working at a certain timeline. And when their gut is mature, their gut lining forms and all that, you want to start introducing allergens. The one every 3 days is too slow. So now
Mhm.
it's kind of like you should go faster. And so from 6 months to 12 months, you should definitely do a tiny health test again, because at that point you want more diversity in your baby's gut. Like remember, at first the island was just all coconut trees and that's it. Maybe 10% of weeds at most, maybe 1% weed. And then from 6 months to 12 months, you really want a lot of vegetation, right? So in a way, a good time to check in is when, if you want to see at the start, of solids, you can check in again. But like now, my baby's eating a lot of solids at 8 months, so I'm checking in again at 8 months to see if his gut is diverse enough with more allergen introduction quicker, a diversity of food. So don't just give your baby like just bananas and avocados every day. You want to
Mhm.
introduce a wide variety of, um, frankly, healthy fats because you want to mimic the composition of breast milk, which is mostly protein and fat and, milk sugars. So a lot of families start with a lot of vegetables that are indigestible.
Mhm.
I don't do vegetables for my baby until 1 year old. I do starchy vegetables a little bit, maybe some steamed carrots and broccoli, but not like, I don't do other like fibrous vegetables. I do a lot of healthy fats and protein. I do liver, chicken liver, I do bone marrow, I do ghee or tallow, even better,
Mhm.
fats like avocado is really good, bananas are good. So things like that are a good start for the baby's digestion because baby can only digest foods that are like breast milk composition in a way. Slowly at 9 months, okay, you can start introducing a little bit of more salmon and more like, I did a lot of meats as well, chicken and beef and all that and bone broth. 9 months, they could start eating a little bit more, like 12 months. Okay, you can probably eat pretty much everything at that point.
That's amazing. I just made some bone marrow yesterday for my girl, but she's bigger now. So, yeah, absolutely. I love that. And I think getting into that could be a whole different podcast in terms of vegetables, right? And kind of going away from what was recommended back in the day to start with veggies. So,
No,
I,
I mean,
I
back in the day, they say start with oatmeal, right? And that is
oh my
actually
goodness.
the word
Yeah.
no, white what is it? White cereal. That
Yeah.
is the worst food,
It's so
and actually
terrible.
there's arsenic contamination in those things, right? There's a
Mhm.
like, I think now people are more educated. If you're not, look it up,
Yeah.
like, white cereal is not the best first foods for a baby, it's not
Mhm.
nutritionally dense, right?
Yeah.
Yeah, so there is kind of a shift on and a lot of confusing guidelines. Of course, do all this with a practitioner that's
Mhm.
informed, and ideally, you're getting someone who's trained in nutrition. A lot of doctors are not trained in
Mhm.
nutrition, right? In medical school, it's just not
Yeah.
taught in medical school. So I would get a dietitian or someone with infant nutrition who's well trained. There's a lot of books that are very credible on this information now that I would give parents. But it's a fun time, a scary time for some, of course.
Yeah.
If you have a history of allergies, for sure, or any of these symptoms like allergy, eczema, allergies, asthma, and hay fever are the basically, like the what do you call it, atopic conditions. If you have a history of that in your mom or dad, of course there'll be more anxiety starting solids. But I think if you check your baby's gut before 6 months and baby's gut look in good shape, frankly, then that gives parents more confidence in starting solids. And that's the
Mhm.
other thing. I'm not
Yeah.
really trying to sell you a baby gut test, but I really do think that this should be universal screening for all babies because it's so
Yeah.
important for lifelong health. Like when you take your baby to a pediatrician visit or well visit, to do the growth chart, right? The weight and the height
Mhm.
every other month, right? You should do a gut test too, because we think
Yeah.
that that is just so crucial. Like I mentioned earlier, these cow's milk protein allergy, and then now a lot of moms have to cut out milk, dairy from the diet and things like that.
Mhm.
And it's so hard for mom. And then we see it so many times when we course correct the baby's gut. The baby is missing certain bacteria, so the immune system is trained incorrectly. So they're reacting to the protein, the milk protein, the dairy protein in mom's breast milk because their guts are not.
Mhm.
So when we do adjust the baby's gut, these things go away. Not always, but most of the time. So if you are having to eliminate something in your diet during breastfeeding, I would say check in the baby's gut, check in your gut too, because most
Yeah.
likely the mom's gut may be impacted as well.
So those are I was about to kind of ask for, like, the symptoms. Obviously, in an ideal scenario, you'll do it no matter what. But for the parents listening that kind of, yeah, will need that extra nudge. So you would say in the first few months, if you see a reaction to breast milk, absolutely get yourself checked and your baby. As well as then when they're a little bit older, what would you say are some like severe signs where you really recommend taking action?
Yeah, I would say even if your baby is so like in whatever the first year of life, no symptoms, check it anyway. That is
Mhm.
just a critical time window. You will never get that time back. That the shift in the baby's microbiome is quick, and we're the only test that maps precisely the reference range in each month. So a 3-month-old baby's gut looks different from a 6-month-old and different from an 8-month-old, different from a 18-month-old. Every stage we are mapping it to what the right balance should be based on science, right? Tons of data around this now. So I would say check in, baby's gut first. And if baby does have some symptoms, check in mom's gut too, because it is connected. If you can afford, maybe dad too, because dads can contribute as well. So depending on affordability, we have a membership plan that makes it a lot cheaper for everyone to do more tests. And then older kids, I mean, because 80% of your immune system is in your gut, any symptoms really can be the root cause can be found in the gut, or at least the gut can be contributing to the symptoms.
Hmm.
So whether it's, in older kids, typically allergies, the same symptoms, bloating issues, constant, maybe like more like constipation, as not enough fiber or like HMOs or prebiotic fiber in the baby's gut, bifidobacteria can impact that too. A lot of older kids don't eat fiber and are more constipated, right? So you can really look into which kinds of fiber that you can nudge them to, make them a smoothie. We give you a lot of tips for picky eaters and
Right. Yeah.
how to like, yeah, sneak some stuff in, like seeds and stuff like that in your smoothies. And then older kids, it could be like skin issues, rashes, acne, things like that.
Mm.
But really, like, the behavioral neurological element, the gut-brain axis is important too. We can measure GABA function, which is your anxiety reducing molecule that is produced in the gut. And in the gut, we also can measure serotonin, melatonin production for sleep. For adults, we can measure GLP-1 production, right? So like your appetite and regulation of eating appetite and things like that. So there's a lot that you can now with our tests, because we're using the latest sequencing technology called shotgun sequencing. We can see a lot of functions in the gut that's really helpful.
That's incredible. So it's really, I mean, it's a full circle move, right? Of thinking about not just food allergies, but thinking about really eczema, acne, immunity, right? Getting sick, as well as behavior and sleep. I think that that's so huge. And a lot of times, it's so funny what you were saying in terms of, the pediatricians might not be educated in terms of nutrition. There's really, now that I think about it, would you even say if you have a baby that doesn't sleep well, that it could be linked to that? And you should see if it's okay. That's,
So
yeah,
like my C-section baby, right? I didn't start the company in time to measure her gut, so I don't have information. But now we have tons of other, whether it's C-section or not, some vaginally born, 30% of vaginally born babies have like not great guts too, no bifidobacteria, and they don't sleep well, right? And my other two boys who are vaginally born, they can sleep for like hours. My daughter was never able to nap more than 30 minutes, which is
yeah.
crazy, right? She kept waking up and she was never a good sleeper. Even now, she's not. She's better now, but she's not a good sleeper. And we think it's from birth. So we see that over and over again that, again, I wish that I had tiny health when she was born, before she was born, in fact. But yeah, like I'm now like I'm so passionate about this company because we're helping so many parents and also just young adults. And we have this aging study now for people over 60 years old for the grandparents to live longer and healthier as well. So we are really the test for the first 1,000 days until the last 1,000 days.
So just kind of looking ahead for tiny health, what do you aim to achieve over the next 5 years?
We are very ambitious. I touched upon this a little bit. We're hoping that we just published an RCT, a randomized clinical trial on babies in the first 6 months, a first year of life, and we managed to show a reduction of eczema and allergies by 83% if you do a tiny health test and follow our recommendations. We don't prescribe, we're not a prescription, we don't cure, we don't treat, but it's more an educational tool for you to understand what's in your baby's gut. So when parents understand that, they take action, they see fewer eczema and allergies in their babies compared to a control group who did our test, didn't know it was tiny health, never got the results back, never got the education, and they had more eczema. So crazy, like a small 52 baby arm that we're now expanding to 150 babies in a larger study with Mass General in Boston. And so we want to eventually be a standard test, right, for infants in the first year of life. And hopefully it's reimbursed fully, right, by insurance or the government and whatnot. So that's like, hopefully achievable in the next 5 years of life. But we are also very active in research and publication. We just today, I think, launched a study in the oral gut axis. We talked about dads and moms chewing food for baby. Is that good? There's the oral microbiome I mentioned. So that's the next kind of thing is like, oh, if you don't have good oral health, should you be doing that? Maybe not, right? So we do think that with the more, again, not to produce more anxiety, but it's just, I think I view this as opportunities to improve your various microbial health because we are just as much microbes as we are humans, frankly, when we're feeding our microbes, right? So if you don't have good oral health, it really does impact your health too, right? So we are looking this research study. You can go to tinyhealth.com/research and see us research partners, basically. But this one I'm pretty excited about because it also is relevant for pregnant, preconception, oral health, right? As you know, it's really important. We want to look at the link between if you have oral issues, does that impact gut health and gut inflammation? If you have gut inflammation, does that impact oral health? Directional, is it directional, right? So there are some papers showing some evidence, but we want to do more research. So you get cheaper kits from both Bristol Health, which is our oral partner, and then us and that. So you'll see a lot more of that. And then we have many, many more plans in the next 5 years of our journey. But I said, we started with the mom baby health, but now we're into longevity and healthy aging. So there's a lot in between, as you can imagine, from conception, fertility insights to autoimmune conditions, diabetes, metabolic health issues, mental health like Alzheimer's, Parkinson's,
Hmm.
oncology, so many facets. So we're really excited in what's to come.
Wow, that's amazing. That's so exciting. Just if you could leave one message for new moms that might be anxious about their baby health, like what would it be?
Well, I always tell myself, like, I made so many mistakes during my early, my journey. Like, I was microwaving plastic postpartum, and I'm like, "Oh my gosh, how much microplastic am I feeding my infant?" I didn't know back then, right? I don't
Yeah.
even own a microwave oven anymore. So as with all things, including baby's gut health and all this stuff, only you did the best with the information that you had at the time, right? And so don't feel guilty. It's never meant to do that. But, I do think that having that data and knowledge is very powerful, as I mentioned, and there's always something you can do about it. It's never too late. And, I think as long as you approach it as, I did the best with what I had.
Yeah.
Now, with more information, I'm just going to approach it one thing at a time. What little thing can I do today in this month? I'm just going to focus on that and tune out. And then next month, what's the next thing I can do? Because we're all busy, I'm sure, and overwhelmed by a lot of things in life. So take it one bite size at a time, and then eventually you're going to get to hopefully most of what you try. I still feel like I still have so many things I want to change in our household, but I'm taking it one thing at a time.
I love that. That's such great advice. For people that, want to dive deeper when it comes to tiny health, where should they get started?
tinyhealth.com. And tiny doesn't just mean babies. It also means the tiny invisible microbes in your gut or vaginal microbiome. So I would highly recommend the Tiny Plus membership. You get 2 kits and one call with our specialist, but you get more kits for cheaper. If you want to sample dad and babies again or yourself again, highly recommend the membership. And you get more access to webinars and live Ask Me Anything sessions with our amazing Chief Medical Officer, Dr. Liz Song. She's an integrative pediatrician, and she also gives a ton of advice around solid introduction, gut health for kids, immune building, flu season, winter, how do you boost their immune system? She gives a lot of great tips. So you get access to her through the membership as well. So yeah, I would say there. And then we're on Instagram at tiny.health. And if you DM us, write in, email us, we're very responsive.
Thank you so much for your time. This was incredible. Thank you.
Thank you, Laura. It was fun.